Endometriosis is a complex and often painful medical condition that affects millions of women worldwide. Despite its prevalence, endometriosis remains widely misunderstood, leading to delays in diagnosis and management. In this comprehensive guide, we'll explore the intricacies of endometriosis, including its symptoms, potential causes, diagnostic methods, and available treatment options. Endometriosis is a chronic condition characterized by the growth of endometrial-like tissue outside the uterus. Normally, the endometrium lines the inside of the uterus and thickens each month in preparation for pregnancy. If conception doesn't occur, the endometrial lining sheds during menstruation. In endometriosis, this tissue grows on other pelvic organs, such as the ovaries, fallopian tubes, and the outer surface of the uterus, causing inflammation, scarring, and adhesions. The symptoms of endometriosis can vary widely among individuals and may include pelvic pain, which may be chronic or cyclical and often worsens during menstruation, dysmenorrhea, or painful periods, which may be severe and accompanied by heavy menstrual bleeding, pain during intercourse, also known as dyspareunia, chronic pelvic pain not related to menstruation, painful bowel movements or urination, especially during menstruation, infertility or difficulty conceiving, which may be the first indication of endometriosis for some women. The exact cause of endometriosis remains unknown, but several theories have been proposed, including retrograde menstruation, which is the backflow of menstrual blood through the fallopian tubes into the pelvic cavity. Another theory is embryonic cell transformation, where hormonal or genetic factors may cause embryonic cells to transform into endometrial-like tissue outside the uterus. There's also the possibility of immune system dysfunction, where an abnormal immune response may allow endometrial cells to implant and grow in the pelvic cavity. Lastly, hormonal imbalances, particularly involving estrogen, may promote the growth of endometrial tissue, leading to the development of endometriosis. Diagnosing endometriosis can be challenging and often requires a combination of medical history, pelvic examinations, imaging studies, and minimally invasive procedures. Common diagnostic methods include a thorough evaluation of medical history and symptom assessment, focusing on pelvic pain and menstrual irregularities. Pelvic examination is another method, where a physical examination is conducted to check for abnormalities, such as pelvic tenderness or masses. Imaging studies like ultrasound, magnetic resonance imaging, MRI, or computed tomography, CT scans, may help visualize endometrial implants and adhesions. Lastly, laparoscopy, a minimally invasive surgical procedure, is used to directly visualize and biopsy endometrial tissue for a definitive diagnosis. Treatment for endometriosis aims to relieve symptoms, reduce inflammation, and improve quality of life. Depending on the severity of symptoms and the individual's reproductive goals, treatment options may include pain management, where over-the-counter pain relievers such as non-steroidal anti-inflammatory drugs, NSAIDs, may help alleviate pelvic pain and discomfort. Hormonal therapy, including birth control pills, hormonal IUDs, gonadotropin-releasing hormone, GnRH, agonists, and progestin therapy may help regulate menstrual cycles and reduce the growth of endometrial tissue. Surgery, specifically laparoscopic surgery, to remove endometrial implants, adhesions, and cysts, endometriomas, may be recommended for severe cases or infertility. Additionally, fertility treatments such as assisted reproductive technologies, ART, including in vitro fertilization, IVF, may be considered for women with endometriosis-related infertility. Endometriosis is a complex and multifaceted condition that can have a significant impact on a woman's physical and emotional well-being. By understanding the symptoms, causes, diagnosis, and treatment options for endometriosis, individuals can work with healthcare providers to develop personalized management plans tailored to their needs and preferences. With timely diagnosis and appropriate treatment, women with endometriosis can achieve symptom relief, preserve fertility, and improve their overall quality of life.